IWP was established in 1994 as a research centre dedicated to investigating employee wellbeing and effectiveness in the workplace. Our mission is to undertake high quality research that promotes better wellbeing, safety, innovativeness and effectiveness of employees in organisations. There's a number of key areas that we look at. Our long-standing interest has been in employee mental health in the workplace and understanding what helps and hinders that, what are the consequences of poor or good mental health, and beyond that also what interventions can we introduce to improve mental health and how do we evaluate that better. We know that's a long-standing concern for individuals, organisations, policymakers, for all of us really. We want to be happy in the work that we do. Second area is around relationships in the workplace, particularly around leadership and team working. And third area is looking at creativity and innovativeness at work, what helps individuals, teams, organisations not just be more creative in coming up with new, useful ways of doing things, but what can they do to actually put those ideas into practice more usefully to create new products, services, ways of working. We've worked with thousands of organisations now over our period of existence in the UK and abroad. We've researched them, we've worked with them also to develop new practices that can really help them and the employees that work for them to thrive. We've got a fantastic set of researchers drawn from far and wide, united with a genuine desire to improve our working lives through using the application of organisational psychology.
So most of my research focuses on the working experience and well-being of staff working in the NHS, and in particular how the experience of staff is linked to patient care that they deliver. So my projects look at how different interventions to help NHS staff with their well-being might link to both improved well-being for them and also how that will affect the care delivered to patients. A lot of our research and other people's research as well has showed that when staff are treated well, when staff are generally considered to be well and engaged, this will lead to better outcomes for them and for patients and for the NHS and society in general. And therefore it's really important that we can deliver, and NHS organisations can deliver working environments that allow staff to thrive when they're under the kinds of pressure that they are under. A new project we're just starting, which is led by colleagues at the University of Surrey, will for the next 5 years look at different interventions that are being used in the NHS. We're going to identify interventions and help to evaluate how effective they are and share the learning from them. So in particular we'll look at routinely collected data in NHS organisations, particularly that collected for NHS staff, and this can tell us how effective different interventions are and how that knowledge can be shared. So what we hope is that in this project we'll be able to say which interventions are the ones which are most effective, the most cost effective, and are most likely to produce good results for NHS staff and therefore patients, so that in the future different NHS organisations will be able to learn from this, decide which interventions they ought to be putting their efforts into, and therefore hopefully in the long run we'll have a much better and healthier NHS workforce and also better outcomes for patients and therefore the country at large.
So the world of work is changing at a rapid pace. Namely, we have AI, which is intersecting with work in all sorts of different ways. But what we're specifically looking at is how AI is monitoring and measuring workers' emotions. Now, this is a really big problem, as some companies are using AI to monitor facial expressions, heart rate, and even tone of voice when people are answering calls. But what we don't know is how does this actually impact the health and safety of workers? This is a really pressing problem as we enter the next decade of work, facing the intersection of AI with work emotions. So this exciting project was launched last year in 2024, and it's been funded by the Institute of Occupational Safety and Health. This project is 3 phases. The first, partnered with the Chartered Management Institute, will look at the landscape of AI in the UK workforce. How many people are currently being monitored by AI in terms of their emotions? And how prevalent is this in business? The next stage is a controlled experiment where we start to understand actually how much does this influence the safety and health of workers. And finally, we're going to do a qualitative study understanding the lived experience of workers and leaders. How are they weighing up the pros and cons of this sort of technology in the workplace? What we don't know about AI is, do the pros and cons balance each other out, or is this actually a great danger for employees? What we're hoping to find out is, what does the future of work look like when we're thinking about well-being and emotions for employees? How can AI benefit and augment well-being, and what are the threats to workers? And that's what we're hoping to discover in this project.